she'll walk out here lopsided if we don't do this. Yeah.
Crooked.
So on this one, remember the colon, we have to go on the left leg, so we have to go from here to here. So we start at the knee. We go up from the knee to the ankle, because then we're doing the other side of the colon line like that. All right. Then
number 22. Press Kukundaraya, sacral points, in Katika Taranam.
Okay, so then the sacral points right there. I'm just going to go up. That feels a little bit sore there. You know, when you press on somebody, you kind of think about whether or not I'm going to cause more pain or not, because then you use the fat part of your thumbs to where it's not quite as intense as if you're pressing like that. So if I find a spot right there, I might want to press a little bit more. And then I go right there. And then I'm going to connect the UB line.
SI joint? Yeah, press and join UB line.
Okay, so remember I press the UB line down to the bottom of the scapula. So now I'm going to come up here like that and walk that down to the sacrum. And that I could do that about 5 times. I'm just going to do it once. And then I again right there on that side.
Both the inner and outer lines, I didn't see.
Yeah,
okay.
Right.
Coccyx treatment.
Okay, so remember that's the treatment we're going to do today. This would be when you do it, because you're going to do it on their left side. So then you're just going to do, you didn't see this one, but I mean you're rotating, you're brushing like that about 5 times, and then you're going to you go to all 3 spots there. This point, you just brush down.
That's right on the tip.
That's right at the base of the gouda, right at the base of the coccyx.
Is one still inferior, my coccyx?
Yours is about right, really.
Better?
Yeah, it's better. You become a little bit more extroverted.
And is that the same area you're pushing as the deep perineal?
No, because the perineal, you're coming down 1/4 of an inch to hit the parasympathetic nervous system.
All right.
But with this, you're right at the coccyx. So with the marma points, they don't distinguish the sympathetic and parasympathetic. With Dr. Stone, since he was a chiropractor and an osteopath, he does distinguish the difference between the ganglion of Empire, which is with the sympathetic nerves, and the perineal technique, which is the parasympathetic. Did I say that right?
Yeah.
Okay. All right, so that spot feels tight, so I'm sorry. I'm going to finish up right there. And then with this, I kind of brush lightly toward the head with my thumb on those 2 points. Okay?
All right.
Perineal,
perineal,
just to balance this side a little bit. And then I think you might have some massage oil in here on the shelf, or I could just use that lotion. See Myers spine, can you see right in there? People who do improper yoga practice, sometimes they have dark spots. Myers it could just be the lighting here, but sometimes you will see the dark area there, which indicates blockage there in the spine.
What of their yoga practice would do that? Just not.
I don't know, but I do know I have a yoga teacher that their spine is definitely very dark in there. I just stick needles in wherever the problem is. I stick a needle in it, but it's lack of circulation somehow or another. It's almost like bruising. I mean, a lot of people who do really super intense yoga, it might be too much for them. They might need to do something slower, lighter, depending on their constitution. If they're kapha, they might be able to do a real hard workout. It won't bother them. If they're vata and they're pushing themselves, or pitta, that could cause blockage. But that blockage will show up as discoloration in the spine when you're working on people.
And that's when you say number 24, oil may be applied to the
Yeah,
spine.
let's see. Let me see here.